Hello, my name is Laura Gillette. I'm one of the clinical staff educators, and today we're going to go over the care and management of a new tracheostomy. So I have Marie here. She's going to help us out with the skills. As you can see, I have my PPE on, including a face shield. I have the bed up in a nice high position with the wheels locked. I have an order for suctioning and care of this trach. So I also want to prepare the room by having some emergency equipment here as well. This is a Shiley size 6 trach, and what I did was have a same size trach at the bedside and one size smaller, so a 5 Shiley is also available. I also have what is called an obturator, which is smooth on this end, and it is for advancing a trach back into the stoma should it get decannulated or pulled out accidentally. So that's another nice thing to have at the bedside. Respiratory can help with these equipment stocking for us also. I have a 10 ml syringe here. This is very helpful in controlling the cuff of this trach, whether taking it down or inflating it. So there's certain reasons why we would have it deflated, such as the ability to eat, drink, use the passing your speaking valve, and to practice when it's time to actually remove the trach and maybe go back to the previous airway. So with that said, another great practice is to not suction routinely, only when the patient is under duress. If they have copious amounts of secretions, we don't routinely suction a patient like this. So I have this COVID particulate HEPA filter double ambu bag here for use to hyperoxygenate this patient should we need to. This area here will go directly onto the trach it fits on so that I can hyperventilate if I need to. And again, the flow meter on the wall is at full 12 liters maximum for 100%. This patient has a trach mask on, and if you notice, it has the large tubing. It goes to some mist oxygen here. Any new trach should have the mist added just to keep the secretions thin and keep the airway moist, also since they're bypassing that nasopharyngeal airway section. I have suction set up over here. We usually suction at 150 milligrams of mercury is a great rate to suction at, so I have that on the wall ready to go. I have it with the yank bar suction here, so I can clear out any oral secretions should we need to. Otherwise, I plan to connect that to my trach catheter when I'm ready to suction. I have opened it just a little so I can grab that with my non-sterile hand when the time comes. I have a few tracheostomy clean and care trays in the room, extra 4x4s, some sterile water or saline, whatever your preference. And I also have an adult tube holder that kind of looks like this, because typically when they come back from surgery, they will have just the twill tape, as this patient does. So we're going to remove that, and we are going to apply the adult tube holder in time. So I also have a continuous pulse oximetry here that I can watch how the patient's going to tolerate suctioning. We're going to start off by suctioning. Here is my kit. I am going to open it up. This is my sterile field. Plastic side is waterproof. I'm going to keep with the 1-inch border being sterile. The dry side is going to go up. There we go. I'm just going to place this down. And then I'm going to dump the contents of my care kit right here. And before I dive into that, I'm going to take my sterile water or saline. I'm going to fill both these compartments. One is going to be for cleaning, one is going to be for lubricating the catheter and flushing it after we suction. All right, so with that said, what I'd like to do now is explain the procedure to the patient and ask them to take some nice deep breaths on their own. I'm going to loosen this trach collar just a little bit so that it's still providing some oxygen here. This is just a precaution to help keep them oxygenated. I'm going to open up my sterile gloves. Place them over here. Careful not to get into my sterile field. Okay, this will be my sterile hand. This is going to be my dirty hand. So I'm just going to take my catheter that I had started the opening with. I'm going to take the catheter, keeping it sterile, and coil it in my hand, like so. My dirty hand, I'm going to take the suction tubing, connect. My suction is on. I have the patient up in a high Fowler's head in neutral position. I'm going to control the suction with my thumb. There'll be no suctioning on the way down, so I insert the catheter right through the trach. I'm going to warn her, this is going to make you cough, and of course she's coughing, coughing, coughing. I insert it till I meet resistance. I pull it up 1 centimeter, and that's when I apply suction for not more than 15 seconds. And I go around and swirl and twirl and suck out all the thick secretions that are in there. I let her recuperate a little. I might flush my catheter a little. Once she's ready, her sat looks great, 99%. Her heart rate's okay, it's at 90. I'm going to go in one more time. Again, till I meet resistance. Usually they are coughing quite a bit at this point. I withdraw about 1 centimeter. And again, follow that swirling around, twirling to get whatever is in there out. I'm going to make note of the consistency and color of these secretions and document that in EPIC, and how the patient tolerated the procedure in general. Now, since this is done, I'm going to rinse the catheter nice and well, wrap my hand here, take this off. I can put it back on my Yankar, like so, in case we need it later. I'm going to take the dirty catheter, the one-time use, and close it in my hand. And move on to cleaning the trach. I'm going to perform hand hygiene with the gel. Okay. And don another pair of sterile gloves, which I have here. Over here. Once the trach is greater than a week old, you don't have to use the sterile technique for cleaning the ostomy. And usually the sutures are ready to come out in about 14 days. You can follow the guidance of whatever the physician has said to manage that. All right. When changing the trach quills, we're going to, best practice is to have 2 people there. So some trachs have a disposable inner cannula, and you'll see how it locks. I am going to clean around the base of this. Now that she has been suctioned, I am going to replace the trach guard itself, the tube holder, and we will see where we go from there. So what I'm going to do is take 2 of my 4x4s and put them on the clean side of my sterile water or saline. I'll let them just soak for a second. Put the dry ones aside. I have 2 Q-tips I can clean the outside of the flange like so. Typically we don't poke it down in any holes because I'll show you a little trick. When we go to clean the inside around the stoma, I'm just going to bring this out a little bit. I'm going to feed it under as gently as I can, leaving that twill tape on there. And I just kind of gently go back and forth on here to get what's underneath, some of that crud. I will get a nice new clean one. Do the same for the other side. This is why we wait to change the holder of the trach till after suctioning, because sometimes they cough up a lot of mucus in this process. So now it's clean underneath, but I want to dry so it's not wet under there, and I don't want skin breakdown. You have to be careful also, because sometimes, most often there's sutures here, and we just want to be mindful that they're not pulling or causing the patient too much distress. So here I am drying around the stoma, and it looks good. A little bit of serosanguinous drainage is to be expected. We'd notify the doctor if there was anything that looked suspicious for anything other. What I can do now is apply my nice new drainage sponge here. I'm just going to put it under here. Careful with the pilot balloon. And put this under here just for some protection. I feel good about that. That looks great. She's still getting her oxygen through the mask here. I can take out this inner cannula, because this is a style that has them. Whether it's disposable, you would throw this away and get a brand new one and insert it and go from there. If this is a reusable inner cannula, you're going to soak it in your sterile water here for a little while. You can take it out, clean it with your sponge that's included. Get it nice and clean, rinse it, and then you're going to reinsert it again and make sure that you lock it. Again, following the curvature of their airway. You can hear it click. There's two dots that line up. So now that that's done, last thing to do is change the trach ties. I'm no longer sterile because I've been touching the outside. But we're going to put on the adult tube holder now. I like these. Be careful that you put them on the right way. There is an outside that if you see, this should be on the outside, the brown should be on the inside, depending on what brand you have, so that there's no skin breakdown. What I'm going to do is leave the ties together, and I'm going to put the new one here. If I had some extra help, I would have another person in here. That is best practice, because what I don't want is just to let this trach be without security on there. So what I'm going to do here is just gently cut so that that's off. I'm going to secure this here. So I have one side secure. I'm still holding it. I'm not going anywhere. The old twill tape I'm moving over here to take out, securing that trach, bringing the adult tube holder here. It's not twisted in the back. There's going to be no skin breakdown from the holder. Gently feed that in through that side of the trach. Just wraps around. One finger tightness should do the trick. And that looks pretty good. You can adjust it as you need to. And that's it. That is really all that is involved with the care of a new trach, suctioning and dressing changes. So